Hey everyone, welcome back for another deep dive. Today we're going to be looking at how AI is changing healthcare administration,
Okay.
and we're going to be pulling some insights from an episode of a podcast called the AI Career Lab.
Cool.
Yeah, so hopefully we can all walk away understanding how AI is going to be impacting hospitals and clinics, and even our own personal experiences with healthcare.
Yeah, it's interesting because so often we think about AI in healthcare. And what comes to mind is, robot surgeons or AI developing, personalized drug treatments.
Right.
But the thing is, AI is also poised to have like a really significant impact on the business side of healthcare too.
Totally. And it's not like some far off thing, it's happening right now. Like even if we just think about the everyday realities of healthcare, like just all the scheduling hassles and the forms you have to fill out and all the paperwork. AI is already being used to streamline those things.
Yeah, exactly. And those tasks could be a huge time suck, for healthcare professionals. Like imagine if you're a hospital administrator and you're just bogged down with paperwork instead of focusing on like improving patient care and how efficient the hospital runs.
Right.
So that's where these AI tools come in, like Nuance Stacks and all of AI.
Okay.
And these tools, they can like automate tasks like scheduling appointments or handling billing and managing all the patient records,
Wow.
which then frees up those administrators to, focus on more like strategic work.
Okay, so instead of me having to like sit on hold for an hour trying to schedule an appointment,
Right.
AI could just do that for me in like a few seconds.
Yeah, exactly. Like these systems, they can analyze patient needs and, they can look at staff availability and then they can just schedule those appointments efficiently, which could mean shorter wait times for, everybody.
That would be amazing.
Yeah.
Okay, so that's cool. So AI can help streamline all that administrative stuff,
Yeah.
but how can it actually like improve the quality of care we receive?
Well, one of the most exciting things about AI in healthcare is its potential to analyze patient data and then use that to predict health risks and recommend preventative measures.
Okay.
So think about all the data that's generated in healthcare. You've got medical records, you've got lab results, even data from wearables like smartwatches,
Right.
and AI tools like IBM Watson Health and Google DeepMind can go through all of that information and identify potential health risks even before you start to experience any symptoms.
Oh, wow. So it's kind of like an early warning system for my health.
Exactly.
So like let's say my smartwatch it like detects an irregular heartbeat.
Yeah,
Could AI like notify my doctor before I even realize that something's wrong?
exactly. That's the power of AI. It can help us move from what's called reactive care to proactive care. So instead of just waiting for you to get sick,
Right.
we can actually catch health issues in those early stages when they're often a lot easier to treat.
That's incredible. Okay. But let's be real for a second. Healthcare is expensive. Does adding in all this AI technology just make it even more expensive?
Well, that's a really common concern, but actually AI can help reduce healthcare costs in the long run.
Okay.
So think about the issue of hospital readmissions.
Yeah.
When patients are readmitted shortly after being discharged, it's disruptive for them and it drives up costs.
Right.
But AI can help reduce readmissions by analyzing patient data to identify those who are at a high risk of needing to return to the hospital.
Oh, okay. So AI could help the hospital identify those high-risk patients and intervene early to try to prevent them from having to go back?
Yeah, exactly. So let's say someone is discharged after surgery.
Okay.
AI can analyze their medical history, their recovery progress, and even things like whether they have reliable transportation to get to follow-up appointments or whether they have a support system at home.
Wow.
And if the AI identifies that patient as being high risk for readmission, it can actually alert the care team so they can take proactive steps,
Like what kind of steps?
like maybe scheduling additional follow-up appointments, arranging home health care visits, or connecting the patient with community resources.
Oh, that's great.
So instead of just reacting to a problem after it happens,
Right.
AI is helping healthcare providers get ahead of the curve.
I like that. Okay, so we've talked about how AI can streamline operations and how it can improve patient care, but there's another big piece of this puzzle, and that's the cost of supplies.
Yeah.
Hospitals are constantly either running out of essential supplies or they have too much of something, and both of those things impact the bottom line.
Right.
So how can AI help with that?
Well, managing resources efficiently is critical in healthcare, and AI can be a big part of that process.
Okay.
Like imagine an AI system that analyzes data from past usage patterns and seasonal trends and even real-time information about disease outbreaks.
Uh-huh.
And then it uses that data to predict the demand for medical supplies with like incredible accuracy so hospitals know that they'll have the right amount of everything at the right time.
So no more scrambling for ventilators or masks during a pandemic.
Right, exactly. AI helps us move from that reactive approach to resource management to a proactive one where hospitals are well prepared for whatever comes their way.
I like that.
And that same principle applies to staffing, too.
Oh, really? How so?
So AI can analyze patient admissions and discharges and even predict fluctuations in demand based on things like flu season.
Huh.
And then it uses that information to help hospitals optimize their staffing levels
Okay.
so they can make sure that they have the right number of nurses and doctors available at any given time.
So they're not overstaffed or understaffed.
Exactly. So you avoid unnecessary overtime costs, but you also make sure that patients are getting the care they need.
So AI is kind of like a master planner for the entire healthcare system.
Yeah, you could say that it helps optimize everything from scheduling appointments to managing supplies and staffing levels, all with the goal of improving patient care and making healthcare more efficient.
Wow, this is incredible. But before we get too carried away, I think it's important to also acknowledge that AI isn't a perfect solution.
Right.
There are potential downsides and challenges that we need to consider as this technology becomes more and more common.
Absolutely no technology is perfect, and AI is no exception, so we need to be aware of the ethical considerations and potential challenges as AI becomes more integrated into healthcare.
Okay, so what are some of those potential downsides that we should be thinking about?
Okay, so we've talked about the potential of AI in healthcare, but let's look at some real-world examples of how it's actually being used.
Okay.
One area where AI is really making a difference is in patient communication.
Okay.
So think about those like frustrating phone trees you have to go through when you're trying to, book an appointment or get a question answered.
Ugh, yeah, I hate those.
AI-powered chatbots are changing that whole
Oh,
experience.
you mean like those little pop-up windows on websites that say, "Hi, how can I help you?"
Exactly.
Yeah, I've used those before, but honestly, I'm not always convinced they're that helpful.
Well, I get that, but these aren't your average chatbots.
Okay.
Platforms like Sensely and Buoy Health use really sophisticated AI to provide like 24/7 support to patients.
Oh, wow.
So they can answer basic questions, they can schedule appointments, they can even offer personalized symptom checking based on what you tell them.
So instead of me having to wait on hold for like an hour, I could just chat with a bot and get my question answered right away.
Exactly. It could save you a lot of time and frustration.
For sure. And I guess it would free up the human staff to focus on more complex cases.
Exactly. It allows them to provide more personalized care to the people who really need it.
Okay, that makes sense. But what about people who aren't comfortable using technology?
Yeah,
Will they be left behind?
that's a really important point. The key is to design AI tools that are user-friendly and accessible to everyone, no matter what their tech skills are.
Right.
And we also need to make sure that human interaction is still a core part of healthcare. AI should be there to complement human doctors and nurses, not replace them.
Yeah, I like that AI as a helpful assistant,
Exactly.
working alongside humans to give the best possible care.
Right.
So are there other areas where AI is already making a difference?
Absolutely. We talked about AI's potential to reduce costs, and there are some really compelling examples of that in action.
Like what?
Remember how we talked about hospitals running out of essential supplies during emergencies?
Uh-huh.
AI can actually help prevent that.
Really?
Yeah, so AI can analyze data from past usage and seasonal trends, and even real-time information about outbreaks to predict what medical supplies are going to be needed.
Wow.
And that helps make sure that hospitals have what they need when they need it.
So no more scrambling for masks and ventilators during a pandemic?
Hopefully not. It's about moving from a reactive approach to a proactive approach, using data to anticipate needs and make sure that the resources are available when and where they're needed.
Okay, I like that. What about staffing?
That too.
How can AI help with that?
So imagine an AI system that can analyze patient admissions and discharges and even predict those fluctuations in demand based on things like flu season.
Okay.
And then hospitals can use that information to optimize their staffing levels.
So they have the right number of people working at any given time.
Exactly. That way you avoid unnecessary overtime costs, but you also make sure that there are enough people there to give patients the care they need.
Wow, it really does sound like AI is like a master planner for the whole healthcare system.
Yeah, it's helping to optimize everything from scheduling appointments to managing supplies and staffing levels, all with the goal of improving patient care and making healthcare more efficient.
That's amazing. And we can't forget about the cost savings from reducing hospital readmissions.
Right.
We touched on that earlier, but I'd love to hear a little bit more about how AI can help keep people from ending up back in the hospital.
Okay, so let's say someone's being discharged after surgery. AI can analyze their medical history, how their recovery is going, and even what are called social determinants of health, like do they have transportation or a support system at home?
So it's looking at the whole picture, not just the immediate medical problem.
Exactly. And based on all that information, AI can actually identify which patients are at a higher risk of being readmitted to the hospital.
And then what?
Then the care team can intervene and maybe schedule some extra follow-up appointments or arrange for a home health care visit or connect the patient with community resources.
Oh, so it's like AI is a guardian angel looking out for patients even after they leave the hospital.
Yeah, something like that. And the impact could be pretty significant. Studies have shown that these AI-powered interventions can actually reduce hospital readmissions,
Wow.
which means better outcomes for patients and lower costs for the healthcare system.
That's great. Are there any other examples of AI in action in healthcare administration that we haven't talked about yet?
Oh, there are tons. One area that's really interesting is how the AI can improve patient flow within hospitals.
Patient flow? I'm not sure what you mean by that.
So think about a patient's journey through the hospital, from the emergency room to their hospital bed to different tests and treatments and then finally discharge.
Okay.
That whole process involves a lot of coordination and decision-making.
Yeah, and I bet it doesn't always go smoothly.
You're right, bottlenecks can happen at any point along the way, and that leads to delays and frustration and even safety risks.
So how can AI help?
Well, imagine a hospital where AI is constantly analyzing data from every department, the ER, the inpatient beds, the operating rooms, even the lab and the imaging centers.
Okay.
And then it uses all that data to predict how patients are going to move through the hospital and anticipate potential bottlenecks and optimize how resources are allocated in real time.
So it's like an air traffic controller for the hospital,
Yeah, exactly.
making sure everything runs smoothly.
Right. And the benefits are huge. AI can help reduce wait times in the ER, minimize delays in getting patients to the right specialist, and even streamline the discharge process so that beds are freed up for new patients.
It's amazing how much of a difference AI can make even behind the scenes.
It really is. It shows how powerful data can be and how AI can identify patterns and make predictions that we might miss.
Yeah, so it sounds like AI is already transforming healthcare administration in some pretty remarkable ways.
It is, and this is just the beginning. As AI technology keeps evolving, we can expect even more innovative applications in the future.
This is all really exciting, but before we get too caught up in all the possibilities, I think it's important to remember that AI isn't a magic bullet. There are potential downsides and challenges that we need to be aware of.
Absolutely no technology is without risks. And when it comes to something as important as healthcare, we need to be really careful and think about all the implications.
So we were just talking about those potential downsides and challenges of using AI in healthcare. What are some of the things we should be thinking about as this technology becomes, more widespread?
Well, like we talked about earlier, data privacy is a huge concern. AI relies on a ton of patient data to work right, and that data is incredibly personal and sensitive, so we need to make absolutely sure that that information is being handled responsibly and ethically.
Yeah, it seems like cybersecurity is more important now than ever. We need to be certain that that data is protected from, hacks and breaches.
Exactly. Robust cybersecurity measures are absolutely essential to protect patient privacy and maintain trust in the healthcare system as a whole as AI becomes more integrated.
It sounds like there's a lot of responsibility on the shoulders of the people who are developing and deploying these AI tools.
There is. We need to foster a culture of responsibility in AI development. A strong focus on transparency, accountability, and always keeping ethical considerations in mind.
Transparency is so important. Patients need to understand how their data is being used and feel confident that it's being protected.
I completely agree. Building trust is essential. And it's not just about protecting data. It's also about making sure that AI is used in a way that benefits everyone, not just a select few.
Equity is a big concern as well. We need to make sure that AI doesn't end up, making existing healthcare disparities even worse.
Precisely. We need to be mindful of the potential for bias in AI algorithms and take steps to ensure that these systems are fair and equitable for all patients.
It's a lot to think about, but I'm still optimistic about the potential of AI to improve healthcare. It's clear that there are challenges, but if we approach it thoughtfully, I think AI can truly revolutionize how healthcare is delivered.
I share your optimism. AI has the power to transform healthcare for the better, but it requires careful consideration and a commitment to responsible development and implementation. It's a conversation that needs to continue, and we all need to stay informed and engaged.
So this isn't the end of the discussion. What we've talked about today is just the beginning.
Exactly. The field of AI in healthcare is constantly evolving with new developments happening all the time. What we've tried to do today is give you a basic understanding of the key concepts, the potential benefits, and the challenges we need to address.
It's like we're giving our listeners a starting point for their own exploration of this complex and rapidly changing topic.
That's a great way to put it. And as you continue to learn about this and engage with this topic, I encourage you to stay curious, ask questions, and don't be afraid to challenge assumptions.
That's good advice for any topic, really, but especially when it comes to something as important as AI and healthcare. critical thinking is essential. This isn't just some theoretical discussion. It's something that's already impacting healthcare systems and patient experiences in the real world.
You're absolutely right. AI is shaping the way we access care, how our health data is used, and even how medical decisions are made. It's happening right now, which is why it's so important to stay informed and be part of the conversation.
The choices we make today will determine what healthcare looks like for, future generations. It's a big responsibility.
It is. But it's also an incredible opportunity. AI has the potential to improve healthcare in ways we can only imagine right now. But we need to approach it thoughtfully and make sure that it's used ethically and equitably.
I started this deep dive feeling a mix of curiosity and apprehension, but now I'm feeling cautiously optimistic. AI has the potential to revolutionize healthcare, but it's up to all of us to make sure it's used for good.
I couldn't agree more. We need patients, providers, policymakers, and technologists all working together to create a future where AI serves humanity and healthcare is accessible and equitable for everyone.
That's a great note to end on. This isn't just about technology, it's about people. And ultimately, the goal of AI in healthcare should be to empower individuals and improve the well-being of all of humanity.
Well said. It's been a pleasure exploring this topic with you. Thanks for joining us on this deep dive into the world of AI and healthcare administration. We hope you found it informative and thought-provoking.
And remember, the conversation doesn't end here. Share your thoughts, your questions, your hopes for the future of healthcare, because together we can shape a future where technology and humanity work together to create a healthier world for everyone. Thanks for listening.